So you're saying you don't want any more kids?
A lot of men have concerns about potentially getting a vasectomy. We've prepared this video to hopefully answer some of your questions and to help decide if a vasectomy is right for you. Now let's review the male reproductive system. The male reproductive system produces sperm and releases them into the female reproductive system during sexual intercourse. When a man is sexually aroused, his penis becomes erect and the sperm produced in each testicle moves through the tubes called the vas deferens to the prostate gland, which is located behind the penis. Here, the sperm mixes with fluid from the seminal vesicles. The semen doesn't leave the prostate gland until the man ejaculates. During ejaculation, the semen, which now consists of seminal fluid and millions of tiny sperm, enters into the vaginal canal. Sperm then travel from the uterus into the fallopian tube and can then fertilize an egg, which could result in pregnancy. A vasectomy is a surgical removal of a section of the tube that carries sperm between the testicles and the prostate. A vasectomy stops the sperm from reaching the seminal fluid in the prostate. The only ejaculate coming from the penis will be the seminal fluid alone. Since no sperm is present, a woman's egg cannot be fertilized and pregnancy won't occur. Since sperm makes up a very small part of the fluid of the ejaculation, there is no noticeable change in the amount or appearance of the semen. Now let's answer some of those questions that Bob and Samantha have.
This is a surgical procedure, right? Are there any risks?
So every surgery has risks. This is a minor surgery that we do in the office, and the two major risks that we worry about are bleeding and infection. As long as you follow the postoperative instructions and take it easy for 2 to 3 days after your vasectomy, you shouldn't have any problems.
Yeah, but what about sexual performance? Are we still going to be able to have sex?
So that's one of the most common questions we get. It's very important to know that a vasectomy won't affect your testosterone, it won't decrease your desire to have intercourse, and it also will not give you any form of erectile dysfunction. Another important thing to know is that it won't affect your climax or your ejaculate. In fact, most couples say that their sex life improves because when they don't have to worry about using contraceptives such as condoms and birth control pills, it increases the spontaneity in their sex life, and they're usually much happier with that aspect of their life.
Well, what are the chances that it doesn't work and she ends up pregnant again?
That's a great question. So no procedure has a 100% success rate, but as long as a vasectomy is done correctly, the success rate should be over 99%. As long as you follow the post-procedure instructions and use some other form of birth control until your semen is free of sperm, you should be fine.
Dr. Rosenbaum, although we're not considering it right now, what if we want another child? Is this procedure reversible?
Yes, a vasectomy is reversible. However, there are a couple important things you need to know about a vasectomy reversal. Number one, the success rate is roughly 80 to 85% as long as the procedure is done within 10 years after the vasectomy. Secondly, a vasectomy reversal is not covered by insurance, so you'd have to pay out of pocket for that procedure. That's why choosing to have a vasectomy is so important.
Everything Samantha and I had heard sounded good. I was given a form to sign giving the doctor permission to proceed with the vasectomy. This is a standard procedure for all types of permanent sterilization. I had my vasectomy right there at the doctor's office a week later. Just before the procedure, I was given a local anesthetic, just a little shot to numb the area. After I was numbed, the doctor made a small incision in my scrotum. The two tubes called the vas deferens were gently pulled out a bit. He applied tiny surgical clips and then cut out a small section of both tubes. He sealed the ends by heating them, called electrocoagulation. I didn't feel a thing. The tubes were pushed back into the scrotum and the cuts in the scrotum were sewn with some small stitches. Then a dressing was applied. The operation itself took only about half an hour. I was a little sore the first day after the surgery, but nothing aspirin or Tylenol couldn't handle. I found that placing an ice pack on the site helped to relieve the tenderness. I was able to shower the next day. The doctor told me to wash my genital area gently and blot it dry with a soft towel. No rubbing. Over the next couple of days, I wore briefs for support and I stayed off my feet as much as possible to help reduce any swelling. Although I didn't experience it, the doctor said there could be a slight discoloration of the skin on the scrotum, along with a bit of oozing blood. He also said that I could experience some tenderness or swelling for a couple of weeks. He told me if I felt any change or a lump in my testicles to contact him. After just a few days, I was pretty much able to get back to my normal schedule and return to work, but I did avoid heavy lifting and strenuous exercise for 5 days. And after about a week, Samantha and I were able to resume our sexual activity using birth control as we had before. The birth control was necessary because some sperm may be in the upper vas deferens even after the procedure, but that sperm will empty out after about 15 to 20 ejaculations. I dropped off a semen specimen at 2 months and again at 4 months for them to check. After the 2 specimens showed no sperm was present, Samantha and I could then resume sexual intercourse without any method of birth control. If any sperm had been detected, I would have been asked to bring in additional specimens until no sperm was present.
Thanks for watching the video. If you have any further questions about having a vasectomy, you can call our office to schedule a consultation.